So today we're going to talk about type 2 diabetes. We're not going to be talking about type 1, but type 2 diabetes is more of a disease of insulin than it is of glucose. Now, let me explain. When you're diagnosed with diabetes type 2, they usually use a blood test to measure how much glucose is in your blood. If it's 126 or greater and tested a couple times, you are a diabetic. So that's called hyperglycemia. This is how they diagnose diabetes type 2. But here's the problem. Retinopathy, that's damage with the retina in your eye. Neuropathy, which is the problem with the nerve in your toes and your fingertips. Nephropathy, which is the problem with your kidney. It's like kidney disease. Hypertension, memory loss, damage with the brain cells, visceral fat, all occur before you get high blood sugar. And this is because the destruction of the eye, the nerve, the kidney, the brain, the heart occurs with high levels of insulin. And it may take 10 to 20 years before you become a diabetic, but in the process, you're getting damage with the retina, the nerve, the kidney, the heart, the brain, and you're getting fatter. So high levels of insulin over a period of time develop a condition called insulin resistance, which I'm going to talk about, which then lead to high blood sugar. The pancreas, the little beta cells, make insulin. And they go into the cells, the receptors, and they trigger a certain process that creates a different effect. One of the primary functions of insulin is to lower blood sugar. But insulin does a lot more. In fact, insulin goes into every single cell in the body. The immune cells, the red blood cells, the fat cells, the muscle cells. The insulin hormone is very anabolic. So the theme with insulin is to make things bigger, to grow things. It's anabolic. This is why people get fatter with insulin. Now the problem is insulin is very toxic in high levels. So the body actually has to protect itself. So it develops what's called insulin resistance, okay? So insulin resistance is purely a protective survival mechanism against the toxic effects. And I've already covered the toxic effects. As your body develops resistance, then we don't get the feedback loop like we should. And the body makes more and more insulin to try to cope. And now we get even higher levels of insulin. And as things worsen over time, the pancreas gets exhausted and it starts to fail in this compensation. Now you cannot keep the blood sugar level. So now the blood sugar goes up. It's basically more icing in the cake, which worsens the situation because it's going to create a lot of oxidation and worsens all these conditions that originated from the high levels of insulin. Now, why is this so important? Because if someone, like your medical doctor, could detect high insulin 10 years ago, they could have done something about it to prevent this problem from happening. And not only that, but if the medical profession could understand this concept, they wouldn't be giving a type 2 diabetic insulin. They wouldn't give them medication to increase more insulin because all that's doing, it's like pouring gasoline on a fire and it's just going to make it worse. So it's very, very important when you get your blood test to ask your doctor to always test your insulin levels, your fasting insulin levels, and make sure it's below 5. Many times you'll see reference points at normals like 8 to 12. But so there's a lack of agreement on what normal is, and that's a whole other video on that. But you want to keep it 5 or